So hello everyone, bonjour. My name is Jacqueline Higgins and I'm the director of the Newfoundland and Labrador Francophone Health Network. Before we get started with the presentation, I wanted to do a quick poll. So if you speak French, either first language or through immersion programs, for example, and feel comfortable having a patient, put a 1 in the chat box. If you've taken a few French courses, but you don't really feel comfortable serving your patients in French, put a 2. And if you really don't know French at all, or bonjour and merci is kind of the extent of it, put a 3 in the chat. Okay, so I'm seeing a lot of 3s there. So regardless of whether you're a 1, a 2, or 3, today's presentation, basically the goal of it is to help give you tips and tricks so that you can better serve the Francophone population here in Newfoundland and Labrador, regardless of your level of French. All right, so a little bit about us before we dive in. So the Newfoundland and Labrador Francophone Health Network is actually part of a national society to improve the provision of French language health services. So we're funded primarily by the federal government and we're nonprofit. We aim to essentially integrate and improve health services and policies here in the province to help better serve the Francophone and Acadian community of Newfoundland and Labrador. So essentially, we do this by promoting existing and available health services in French in the province. We equip our community with resources such as our health passport, which is a medical terminology passport, and our mental health and addictions guide. We also look at supporting bilingual health professionals or those who seek to become bilingual through our health professional membership. So this is providing you with tools, practice opportunities, resources, etc. We also advise our partners, such as the regional health authorities and the provincial government, on the planning and implementation of French language health services. And finally, we coordinate government-funded projects to address the needs of the community based on feedback and studies that we do throughout the province. So how much do you really know about the province's Francophone population? Probably not much, right? We barely hear about them. You've likely met patients from St. Pierre and Miquelon, but otherwise you might be unaware of the local population here in Newfoundland and Labrador. According to a study completed in 2019, the Francophone Federation here in the province estimates that there's approximately 5,930 Francophone residents here in the province. So they're actually primarily situated in St. John's, the Port-au-Port region on the west coast. Corner Brook, we have military families in Gander. We also have Quebec residents and other Francophones in Land City and Happy Valley Goose Bay. What's not included in this 5,930 are students from other provinces, for example, New Brunswick and Nova Scotia, who come here for essentially affordable tuition and a great education in MUN. It's also not counting all the fly-in, fly-out, and temporary workers who come here to work. For example, there's direct flights from Bathurst to Labrador. So Bathurst, New Brunswick is a significant Francophone community. What's also not included in this is our approximately 6,000 residents of St. Pierre-Miquelon. So all of these people utilize our health services here in the province, which is a good thing because it's bringing money into the province to the health authorities. And it's also allowing us to increase our diversity. We've actually seen a massive increase in immigration in recent years, and particularly in Francophone immigration. Just a fun fact, so apart from Quebec, Newfoundland is actually the province with the highest proportion of Francophone immigrants in the country. So that's increasing at a drastic rate, and all of these people require support and services, preferably in their own language. So why do we not really notice that there's a local Francophone population here? Well, a large portion of Francophones here in the province are bilingual. That being said, being able to speak English like myself does not necessarily mean that we don't face language barriers, particularly when it comes to something as technical as health or finance, for example. So health-specific terminology is especially difficult, even if the person has learned English as a second language. So these Francophone communities face many language barriers that affect the accessibility, safety, and quality of the health services that they receive. And especially in crisis situations, when someone is sick or when someone is elderly, human beings in our nature, we often revert to our first language, our mother tongue. And this has been proven throughout various studies throughout the years. And this is particularly true for unplanned hospital visits. So, for example, going to emerge, in comparison with planned appointments where a bilingual Francophone has time to prepare and search for specific translations. And it is because of these language barriers that Francophones don't necessarily actively request French services or mention that they'd rather speak with someone in French. The issue with that is that they're afraid of either longer wait times, being a burden on the system or an inconvenience on the system, and also poor service quality. For example, if there's two cardiologists, one of them is bilingual and one of them speaks English only, but that person who speaks English only, they're worried that that might be the better doctor to go with. So they don't want to be picky, they want to go with the best person. But the issue with that is that it can cause issues with language barriers, miscommunications, and that increase in demand also leads to an increase in a decrease in availability of French services. So it sort of creates like this vicious cycle where, since there are no requests, the province doesn't implement French services. So our research has shown that in Newfoundland and Labrador, there are very limited French language resources, and these resources are often either not actively offered or promoted. There's also a limited number of bilingual healthcare workers, despite the province having a relatively popular immersion program in grade school and a very strong program here at MUN. So we guess that a lot of it is lack of talking skills or the confidence to really offer services in French. So additional support and practice opportunities could potentially increase the bilingual workforce here in the province. And finally, there's an absence of French language services, particularly in areas where interpretation services are insufficient. Can anyone think of an area of care where an interpreter having a third person involved might be uncomfortable or inconvenient or difficult? You can put your answer in the chat or you can speak up, either one. How about, I'll give you an example. Long-term care is an excellent one. So specifically with the elderly population, a lot of times they'll lose any learned language, second language. And then with that comes memory problems, cognitive decline, things like that, that require a little bit of extra effort. And having an interpreter in those situations can lead to a lack of trust between the patient and the practitioner, because they're not able to create that trusting bond that you normally would in a normal situation with an English-speaking patient and an English-speaking professional. Abuse is also another one. I'm thinking particularly mental health as a whole. Mental health is very difficult to express through interpretation, mainly because people use an increased amount of expressions. And there are certain emotions, for example, that don't translate easily in between languages. And then again, having that third person, that stranger in the room with you while you're seeking mental health services can lead to additional stress, can further increase the crisis, can lead to miscommunications, and can be very uncomfortable for not only the patient, but the practitioner as well. So that's absolutely right. So there's various areas like this. Reproductive health is another one, where essentially the presence of an interpreter can either lead to just as many miscommunications, other errors in terms of getting your feelings across, and it also comes as a barrier in between the practitioner and the patient who are trying to build a relationship. So the risks of this is that language is essential for the health outcome and self-management of one's health. We use language to express our symptoms, our feelings, what we're going through, and not having that language barrier can lead to errors in diagnosis. errors in medication. For example, if someone's taking multiple medications and they're all at different frequencies and different times with different requirements, that can all get lost in the interpretation process or in the conversation. Even if the person is bilingual, it can be hard to sort of keep up. There's also the issue of the legal side of things. What is considered informed consent if the person can't really fully comprehend English, if they're going through an interpreter? Is it really considered quality informed consent? Language barriers can also affect patient satisfaction and also practitioner satisfaction. So you as nurses speaking with your patient and trying to get your point across when the patient isn't able to understand can be frustrating and lead to just an unpleasant experience for the both of you. It can also lead to, for example, longer hospital stays because you're performing more tests than are necessarily needed where the symptoms aren't really clear. And ultimately, it can lead to poor health outcomes. So the biggest issue is misunderstanding the patient's complaint, which can lead to misdiagnosis and improper treatment options and even professional malpractice. So by reducing these risks, both you and your patient will have a better experience. So one of the primary ways that we reduce language barrier risks is through what we call the active offer of French language health services. So this essentially means to actively offer a service so that the Francophone population doesn't have to specifically request it. So this can include French services that are available at all times. They are clearly communicated so that the patients are able to know exactly what's available. They are visible, so when the patient walks into a clinic or a hospital, they can see what's available to them. They are culturally appropriate. They are easily accessible, and they are equivalent in quality to the services that are offered in English, therefore reducing those fears of the Francophone population, which will eventually lead to increased demand or increased request of services. So the key elements of the active offer of French language health services are the recognition of linguistic and cultural needs of your patient. And the concept of the active offer can actually be used for anyone whose first language isn't English. So it's just recognizing that that person has those language barriers and may have cultural differences, and then you adapt accordingly. The second element is the accountability of the healthcare providers and professionals. So as healthcare professionals, it is your responsibility and it is your passion to be able to essentially serve your patients and make sure that they get better and they're happy with their experience and that ultimately their health outcome is good. And then finally, improving access to quality French language services to help achieve health equity. So I'm sure in your studies and continuing education, you have seen some variation of this diagram here. So I'm not going to get into health equity in a whole lot of detail where you're probably already familiar with it. But essentially, it allows people to reach their full health potential and receive care that is high quality, fair, and appropriate, regardless of where they're from, what their culture is, their socioeconomic status, and as well their language. It's part of that social determinants of health. So some people essentially need a little bit more support than others in order to achieve that same health outcome. So what can you do and what can your workplace do to help improve the active offer of French language health services and then reduce those language barriers? So some of the things are identifying the language of preference of your patients, which is a simple question. Identifying and hiring bilingual healthcare professionals and placing them in key areas where they would be needed the most. Having bilingual friendly reception. The point of entry into a clinic or hospital is extremely important. And that's where the patient is going to get a sense of whether or not they can receive their services in French or if they're going to have issues along their health pathway, essentially. One of the big ones that we do here in Newfoundland is the offer of professional interpretation services, which are extremely useful in certain areas of healthcare. And finally, it's monitoring patient satisfaction and using that feedback in order to improve certain areas strategically so that you can offer better services for the Francophone population without overdoing it and providing services that aren't being used enough. So the first one is language of preference. The linguistic identity of the patient should ideally be collected at point of entry as soon as they register at the hospital or at the clinic. This information should include their mother tongue, so their first language, and then their official language of preference, so whether it's French or English. So the reason why we ask these two separate questions is because of those who were born outside of the country, who their mother tongue may not necessarily be an official language here in Canada. And so achieving services for every language is much more difficult than doing a few key ones. So this information is not only important for you as a healthcare practitioner, because at least then you know what to expect when you go to meet that patient for the first time, but it's also really important for provincial data collection. So this type of data allows for Eastern Health and other regional health authorities to better plan their bilingual services and appoint bilingual professionals to where they will be needed the most. So actually places like Eastern Health, for example, do have a significant bilingual workforce. It's just that they may not necessarily be in the areas that they're needed. The next one is to identify and utilize bilingual staff. So identification is fairly simple. It can be as easy as tracking people through the hiring process based on their language skills, so collecting language skill data from employees, or it could be something a little more physical in terms of visibility, such as a hello, bonjour pin, or some sort of signage or identification that says French services offered. That way that person is easily visible to the Francophone patients when they're waiting to see someone. The next thing is to equip those people, those bilingual staff, with the tools and the abilities to offer French services. So that can be a wide variety of things, from practice sessions to continuing education credits in French, to resources such as information pamphlets, online information that they can recommend to their French-speaking patients if they're looking for additional information in French. So if you're interested, if you do speak French and are wanting to identify yourself, feel free to contact us. We do have a program specifically for supporting bilingual professionals to help increase your visibility and give you practice opportunities. So essentially the goal of this is to better utilize bilingual workforces in a clinic or a health authority. And doing so, we're able to better place those people in areas where the Francophones are requesting the most services. So emergency would be probably one of the priorities, for example, or other areas where interpretation services can't easily be used. Those would be the areas where we would want to put bilingual employees as much as possible. So the next element of the active offer is visibility and communication. So this is for more so the patients. So as some of you probably know, hospitals are often very big and confusing, difficult to navigate, a lot of identical hallways and inadequate signage. So by not having bilingual signage, it's even more difficult for a Francophone patient to be able to navigate that system, find out where their appointment is. Even the registration process, for example, when you have forms, oftentimes they're only available in English, and there's quite a bit of text on them, which makes it very difficult for those patients, which adds additional stress, which is never good for their health outcome. And it just creates a lot of confusion. It can lead to delays in their appointment time as well. For example, if they're stuck at registration for 30 minutes, they might be late to their appointment. So bilingual documentation is really important, specifically things like registration forms, as well as consent forms, having something available that they can read in French, even if it's a bilingual form, so where you have the French and English version on the same sheet. That's the best way to sort of go about it, so that the patient can understand the form, can fill it out, and then whoever they give it to, if they don't speak French, they're still able to interpret it as well. What's also important is things like a bilingual services web page. So for example, Eastern Health has a page on bilingual services, and they talk about the interpretation services that are available. Certain tools being available in French for patients. I'm thinking in particular prenatal information, or things for expecting mothers. There's a lot of self-learning that has to go on during that process. And a lot of it, the things that are recommended by healthcare professionals aren't always available in French. So little tools like that, being able to find a French alternative for them to access, can sort of help reduce their need for asking additional questions during their appointments. And then finally, training administrative staff to be able to welcome those people and then redirect them to the service that can help them, whether it's interpretation or a bilingual employee. So again, it's all about identifying and making sure that it's visible that they can ask for a French service in that location and then be redirected to whatever is appropriate. So the next item is interpretation services. So we highly recommend, when there is a shortage of bilingual healthcare professionals, that healthcare authorities and clinics use professional interpretation services. Now, we've heard in the past, and it's an issue all over the world, is that oftentimes people will use Google Translate to be able to get by speaking with their patient. But actually, according to a study done a few years ago in the British Medical Journal, Google Translate actually only has a 57% accuracy when using medical phrase translations. So 57 is not very high. To miscommunications, additional issues, problems with medications, etc. So interpretation services, when done professionally, are an excellent alternative for establishments with no bilingual professionals. It allows for essentially that service to be utilized in a flexible manner. They're often a telephone contract, so they're available at all hours of the day. And then that way you're getting a professional interpretation service, which will minimize risk. However, as I mentioned, in some areas of care, interpretation services are not necessarily an adequate solution. And this is particularly so when it comes to in-person interpretation services, especially here in Newfoundland and Labrador, where the community is so small. A lot of people have a fear that they'll go in, meet with an interpreter and a doctor, and that interpreter just so happens to be a Francophone that they go to soccer practice with their kids with every Saturday, or things like that. So it does kind of come into an issue with confidentiality and comfort. So there are certain areas where an interpretation service isn't the best option, but it can always be used if there's nothing else. However, family members and friends should never provide interpretation. And the main reason of that is that they're not necessarily proficient or accurate in their translation. They may add unsolicited advice, whereas a professional interpretation service will translate word for word and not add anything additional. It can lead to an increase of errors if you're having someone who's not professional provide interpretation. And also with family members and friends, there's a risk of sugarcoating or hiding information to avoid having to deliver difficult news, which is why an interpretation service is always sort of the better option when possible. So what can you do as a healthcare professional with this? Well, talk to your employer about what they have in terms of available interpretation services. For example, all 4 health authorities here in the province have a telephone interpretation contract. The issue is that a lot of people don't necessarily know how to use it or what the conditions are. So write down the protocol for accessing your interpretation services at your workplace. Talk about it with your colleagues and other people in your clinic or department so that they're aware, and actively ask your patients if they require an interpreter. So anytime you sort of get a hint that English might not be their language of choice, it never hurts to ask. And actually this interpretation service, these telephone interpretation contracts, have more than 150 languages on them. So they're an excellent resource, and it's just about knowing how to utilize them. So to ensure sustainable improvement of the active offer of French language health services, healthcare professionals must become catalysts for change and provide innovation in their work environment. So essentially, as healthcare professionals, it takes leadership and initiative in order for the active offer of French language health services to work. So the Canadian Francophone Health Networks divide the responsibility of the active offer into 5 main partners. The first one is policymakers. So that's our members of government, both federal and provincial. We have our administrators, so our managers and executives who work in our health authorities. We have our healthcare professionals. We have educational institutions, so that's our researchers, our professors, those who are collecting data. And then finally, we have our communities, because they have a responsibility as well to request and fight for services in their language so that they can reduce their own health risks. So as healthcare professionals working in a clinic or public and community sectors, for example, it's important to use your professional, linguistic, and cultural competencies, as well as your ethical judgment to assist your patients in any way that you deem necessary. This is the way that you ensure quality of care and safety for your patients. So the role of a healthcare professional in the active offer of French services is to proactively welcome Francophone patients, seek to understand their needs, and then provide them with the necessary care or refer them to the resources able to provide such care. So essentially, say you have a patient arrive who's struggling a little bit with their English and asks if anyone speaks French. This is where it's really important to step up and offer an interpretation service, or seek out a colleague who speaks French and ask them if they would be able to take over that patient. It's important to take on a leadership role in this environment in order to make sure that those patients feel safe and understood. So as I mentioned, healthcare professionals, it is extremely important that you show leadership and initiative to help improve the system. So essentially, the active offer of French language health services can't happen without you. So you can essentially demonstrate leadership in 2 ways: by actively offering French language health services yourself, if you're able to speak French, and if not, exercising a positive influence on your workplace, on your colleagues, and on your communities, so that people better understand the realities that linguistic minorities face and what we can do about it to make sure that they get care as well. So the leadership skills required for the active offer can be divided into essentially 3 categories. So we have our value and ethics, our strategic thinking, and commitment. For value and ethics, it's all about supporting the reduction of health inequalities, as well as striving for improvements in inclusion and equity. And as I mentioned, a lot of the principles in the active offer of French language health services can be applied to anyone who has difficulty speaking English, so anyone who is a linguistic minority. So this is where it's important for healthcare professionals to look into committees. For example, if your company has a diversity and inclusion committee, to also read up on company policies on inclusion and speak up in your team meetings or departmental meetings if you notice that there's a gap in the provision of care, or if you've witnessed a patient struggle due to a lack of resources or services. This is how this feedback is able to sort of go up the chain of authority and then actually be implemented to improve their lives. The next is strategic thinking. So this is demonstrating critical thinking on ways that your workplace can implement the active offer of French language services and bring issues at the forefront of your employer's concern. So as I mentioned, we all have a role in making sure that any discrepancies in the provision of care or reductions in quality or increases in language barriers that we witness on the floor or in the clinic, that we make sure that that information gets to those who are able to make the changes. So start a conversation with your colleagues and your supervisors. What can you do, or you all do as a group, to make your clinic or department more bilingual friendly? It could be something as simple as having a few bilingual pamphlets available with additional information. If you work at Planned Parenthood, for example, resources are incredibly important. And if you have access to websites, especially national websites where they provide medical information, a lot of times they're bilingual. And so make sure that you know where you can find those resources if ever you need to. And finally, it's commitment. So demonstrating commitment to the active offer of French language health services and ensuring that your patient's linguistic needs are met. So this is where it gets kind of tough because it's easy to get discouraged and the changes can often be slow. We at the Francophone Health Network, we've seen that, we felt it. So what's really important is to not get discouraged. If you can't do a lot, then that's okay. But any small effort that you make makes all the difference in the world for your patients. So given all that information, that was just a very short little brief overview of a training that we actually do offer online. It is adapted to the specificities of the Newfoundland and Labrador healthcare system, though it is a nationally created program, all on the active offer of French language health resources. It is a free online training available in both French and in English. It's completely on your free time, so you can pause it and get back to it if you'd like. There is an option to take a 3-hour or a 5-hour course. The 5-hour course is for management and the 3-hour course is for healthcare professionals. And this is widely recognized as a continuing education credit opportunity. For example, it's worth 1.5 and 2.5 continuing education credits respectively for the Certified Health Executive Program, which I believe Eastern Health does in partnership with the Canadian College of Health Leaders. But there's multiple organizations that have that partnership with the CCHL as well. So I highly invite you to check it out. It's very interesting and it gives you a little bit more information about some of the experiences. There's a lot of videos from patients about witness statements and things that they've sort of gone through in their healthcare system. So it really gives you an idea of what they face in a primarily English healthcare system. On top of that active offer training that's available, the Francophone Health Network offers a wide variety of resources and activities specifically to support healthcare professionals, not only bilingual healthcare professionals, but also those who just want to have a positive impact on their French-speaking patients. So as I mentioned, we have the active offer training, which is, like I said, it's very much to raise awareness on the different types of language barriers and how you can address them. We also have health passports. These are little pocket guides of medical terminology being translated from English to French and French to English. And it also provides a little bit of important information that might be used for the patient. So this is all to help facilitate communication when there may not be other resources available. We also have a professional directory. This is mainly for our bilingual healthcare professionals. So this is essentially free training, credit opportunities in French, the ability to practice and continue in learning your profession in French. We also provide things like scholarships and other opportunities specifically to help French-speaking healthcare professionals be able to better support the Francophone population and actively offer their French services. And finally, this one is more so for our management healthcare professionals. We have a platform specifically for helping to implement bilingual health services. So this is almost like a project management tool. It starts off with a self-assessment of your workplace so that you understand where the gaps are in terms of your services. So this is one that I highly recommend for larger organizations like the regional health authorities, for NLCHI, for example, where they're able to really assess where the gaps in the services are, and then they're able to plan the implementation of French services adequately and strategically so that they're putting their resources into things that are actually needed, which is better overall financially for the organization, and it's less time consuming. And finally, not only are we there to help the Francophone population, we recently implemented a navigation system here in Newfoundland in collaboration with Eastern Health. So one of you, actually, a registered nurse, is a Francophone health system navigator. She is there to not only help patients, so help French-speaking individuals and their families, she's also there to provide an additional support for health workers who are seeking an assistance to better serve their Francophone patients. So for example, if you're working with a Francophone patient and they're looking for additional information, or they'd like to ask a few more questions, or they're struggling to understand some items, you can reach out to the navigator so that she can walk through, for example, their post-op instructions or their medication instructions with them. So that's just an additional level of support to sort of help that person really get the quality of service that they need so that their health outcome will be positive. And that's it. So thank you very much. Essentially, you can reach out to us. Please don't hesitate to visit our website or our social media. If you have any, if you're interested in learning more about some of the programs that we currently offer, or you're interested in becoming part of our directory, please don't hesitate to send me an email and I can go over what we offer in terms of support. Thank you.